Finally, on the news now to health matters, where a new analysis published on Tuesday in the medical journal The Lancet, millions of children worldwide have been left vulnerable to preventable diseases including measles, polio and tuberculosis. The medical investigation reveals life-changing vaccination efforts have stalled or reversed since 2010 amid persistent health inequalities, misinformation and vaccine hesitancy. It also says protection from measles in particular have dropped in 100 countries, including rich nations that had previously eliminated the highly infectious disease. Authors of the report from the University of Washington say progress is rolling out vaccines over the past 5 decades have prevented the deaths of 152 million children. But by 2023, nearly 16 million hadn't had any childhood vaccinations, most of them in sub-Saharan Africa, South Asia, with more than half of unvaccinated children in Nigeria, India, Congo, Ethiopia, Somalia, Sudan, Indonesia, and Brazil. And joining me now for more discussions on this is an Associate Professor of Infectious Disease, Molecular Virology and Genomics, Oladipo Kolawole. Good to have you on the news at this time. So first off, what does this drop in vaccination coverage since 2010 now mean about global health systems, and why have both developing and developed nations still struggle to contain or sustain this progress?
Yeah, let me just give a brief background about the work. I think they were able to analyze some data sets from 1980 to 2023, and they were able to make some projections, did some modeling to give us an idea what is going to happen in year 2030, so that necessary measures can be put in place for us to make sure that we achieve the global health strategy of the WHO 2020 agenda in terms of immunization. So what they did invariably have exposed the challenges that we have, and the funny thing about it is that Nigeria is one of them on the childhood immunization. And to talk further, though the study has limitations, they spell out 6 limitations from the study. And one thing they come to say is that we need to strengthen our health system in order for us to achieve the 2030 immunization schedule that we have on board presently.
Right. Well, in light of these findings, what other innovative technologies now, be it policy-driven or grassroots, that could help reignite this vaccination momentum? What can you tell us?
Yeah, now another thing that I want us to know for sure now is that so far our country is measured, there is underfunding of vaccine. You know, most of the time that those vaccines that we obtain, it's obtained basically based on donation. And you can see that now our government needs to step up the gear, take responsibility both at federal government, at state level, to purchase vaccines so that children can have access to their normal routine vaccination. And also, we need to engage some religious and traditional leaders for us to. Then, another thing I've seen is that we need to localize our solution. For instance, in Nigeria, the problem we are facing in the Southwest is different from the problem they are facing in the North. It's different from the one they are facing in the East. So we need to localize solutions and not importing existing solutions from other country or from another continent and adapting it to ours. We need to localize it. And one thing I've seen again, that we need to improve maternal education and access to healthcare. I'm a grassroots person, and when I go to villages, I wonder if we can really penetrate and get to this stage where we can have children being vaccinated. So our government needs to go an extra mile in achieving these. And these are preventable vaccine diseases. For instance, they talk about polio, they talk about measles, they talk about diphtheria, they talk about pertussis. These are vaccine preventable diseases. And we have seen in Nigeria occurrences. Look at cholera too. is the vaccine preventable diseases. So we need to step up the gear and rise up to the task, not waiting for donation this time around, for us to really buy this thing and make sure it is effectively distributed accordingly.
Yeah, you actually hit the nail on the head, but there is this challenge of cultural belief where most countries, or some states in Nigeria particularly, they do not believe in vaccine. Particularly, I'm sure you remember a particular vaccine that affected some children in the north and made families not to want their children vaccinated. The issue of culture, tradition, these are biases. How can we penetrate deep in states or regions that have phobia, more or less, about being vaccinated?
That's what I talked about. But attracting this, we need to talk about it in a local dimension. We need to use people that people trust to speak to their community. Because if I'm a grassroots person and I've been doing sensitization, there was a time I even go to secondary school to talk about HPV vaccination to people. So if we see people that are trusted, we have health influencers that are trusted, that can help drive the message to the grassroots, it will be easier. And that's what I mentioned religiously that, some even believe that, oh, why do I need to take it because of adverse effect? Yes, we need to explain there could be some little adverse effect, but at the end of the day, the gain the advantages outweigh the disadvantages. And that's just form of few number out of many that we are talking about. And this vaccine have saved more than 154 million children worldwide since the inception of it. So we need to do that to enable them to. Then we need to come up. I will talk about National Orientation Agency, Federal Ministry of Health. They need to come out with a lot of influencers to talk about this in local language, in English language, so that people can trust. Then they need scientists that are working on this. During the era of COVID, there was an era that people were saying that if you get COVID vaccine, you became infertile. These are pure lies. So we need scientists also to come out and talk about it. Another thing again is that our government needs to put money now into research and development, so that if most of these vaccines being used are developed by our local scientists, are produced by our local manufacturer companies, the level of trust will be more higher than what we are importing into the country. And these are ways that which the government can really help the population.
All right, and that's a fine place to leave it. Thank you so much, Associate Professor of Infectious Diseases, Molecular Virology and Genomics, Oladipo Kolawole. We appreciate your insights on the news at this time.
Thank you.
And that's it on the World Now. Many thanks for being a part of it. For more updates on the stories we are monitoring, you can check us on our website, tvcnews.tv. You can also follow us on all our social media handles, Facebook, Instagram, and on X at TVC News NG. On YouTube, we're live at TVC News Nigeria. Many thanks for watching. I'm Esther Makwariola.